Testicular cancer typically affects younger men, although there's a peak in the teens, 20s, and 30s, and there's another peak actually in the 50s and 60s. When I meet with a young man, often they have this perception that cancer only occurs in old people, and they may even feel guilty about having had a delay in diagnosis. Sometimes they had a feeling that they might have testicular cancer, and they were so anxious and concerned about what was going to happen to them from a body image standpoint, from a fertility standpoint, from a am I going to die from this disease standpoint, that they're paralyzed and have a difficult time coming in, or they delay diagnosis because they're in denial. The fact that actually testicular cancer is the most common solid tumor in young men, and that there is this highest peak in the teens, 20s, and 30s, although there is a second peak in the 50s and 60s. There is an association between lower fertility and testicular cancer, but we do a lot with men around the time of the initial diagnosis to make sure that we do everything we can to preserve their fertility. And thankfully, most men are able to have children after testicular cancer therapy, either on their own or with assisted reproductive techniques. But we do everything we can, and thankfully, most of the time we can preserve fertility for men after treatment for testicular cancer. Testicles are ornamental. They hang outside the body. We know they're there, or we can see them in the mirror. Other people can see them if we're walking around the gym and our towel falls down. What I remind men is that when we remove the testicle, we leave the scrotum exactly where it is. And a man in a gym that loses their towel is not going to be recognizable as having one testicle versus two from across the room. The ornamental aspect is usually not a big concern for men. Obviously, some men are worried about their body image, about how they're going to feel, about how they're going to look. And thankfully, for men that do have concerns about that, we can put in a fake testicle, a prosthesis. And that's indistinguishable for most people from the testicle that was lost.